Hello, I'm Dr. Steve Kopecky, a preventive cardiologist at Mayo Clinic in Rochester, Minnesota. And this is the next in our podcast series on prevention from the Department of Cardiology. Today, I'd like to introduce our guest, Dr. Scott Wright, who's professor of medicine at Mayo Clinic here in Rochester. Welcome, Scott.
Thanks very much, Steve. What a pleasure to join you on this award-winning podcast.
The subject today will be lifestyle modification in the setting of new preventive therapies. Is what we eat, how we exercise, how we sleep, how we manage stress still important? So, Scott, we have some great medicines now that you've been involved with and we're using quite frequently, injectables to lower cholesterol, etc. Is what we eat still important?
Critically important. Most people fail to remember that all therapies are based upon the patients are taking in a low-fat, low-cholesterol diet. And the healthy diet, which I think is the Mediterranean diet with lots of appropriate oils and nuts, legumes, olives, and vegetables, that is so healthy not only for heart health, but also for reducing inflammation and lowering cancer risk. One of the real misunderstandings about treating elevated blood lipids is that you only need pills or injectables. You don't. You can actually undo all of the benefit of these therapies by eating a very poor diet.
That's great to hear, and that's a message our patients really need to know about. I certainly agree. So you mentioned the most heart-healthy diet, the most studied really has been the Mediterranean, and you mentioned the fruits, the vegetables, legumes, whole grains, the extra virgin olive oil, a few nuts, and really every culture kind of has that, don't they?
Oh, they do, and people know intuitively when they eat those foods, they feel better. When they eat highly processed foods or foods high in saturated fat, you feel bloated, you just don't feel good.
And the classic Predimed study, the New England Journal study, showed a diversion of the curves, survival curves without events, within about 3 months, long before anything else could have happened, such as weight loss or lipid changes. So it really is, as you mentioned, an anti-inflammatory diet, isn't it?
It truly is, and so couple that with your medications, and also it's also more than just diet. It's regular exercise that doesn't injure your muscles. It's also a healthy sleep pattern. It's also stress management, and just managing your life totally. We all have to be in charge of our own health, and most especially physicians and healthcare providers, we're probably the worst at managing our own health and taking care of ourselves. And if we have any listeners who are in the health fields, I would say you're the caregivers. Please take care of yourselves.
Good point. Now, the data for this is not overwhelming, but the studies that have done it, such as some of the studies that were going for statin approval, where they looked at their diet and said, did you eat Mediterranean or not? I remember one study specifically a few years ago that showed that if you didn't eat Mediterranean, your lipids came down with a statin, but your events really didn't change much compared to placebo. How do you tell that to your patients, Scott?
I think you just have to say basically and simplistically that your diet can offset the benefit of the medications. Don't spend $10, $20, or a few $100s a month on medications if you're going to destroy all that with your diet. And that's the important lesson, that it's the whole deal we have to really work on.
And you point out to them that the diet probably won't change the lipids much. It may change triglycerides if you're eating a lot of ultra-processed carbs. But, sometimes patients think, or at least mine do, I like to your opinion, they think that, gee, I've eaten so good and my cholesterol is still high. What did I do wrong?
They do, and I think they get disappointed, and especially as we all get older. I tell my patients every 10 years that you get older, your body's ability to clear cholesterol goes down just a bit. That's why cholesterol tends to go up with age. And so don't be discouraged at that. At best, diet will lower cholesterol 10 to 15%, but it's doing far more at reducing your inflammatory risks, your cancer risks, and really changing your triglycerides. When I have patients with lipid profiles where the triglycerides are quite high, I often ask them about those foods you mentioned, simple sugars, lots of fats and other things. Are you eating those things? And we have a little discussion about the importance of paying attention there.
Good point. Do you find it helpful to talk to your patients in general terms about the other benefits, such as the DISCO study a few years ago showed that patients on a DASH diet, which is basically Mediterranean with low sodium, and regular exercise had a much greater regression in their lipid-rich coronary artery plaque than those that didn't do the DASH or the exercise, but both groups were on a statin.
Well, I try to simplify that. I think we can oftentimes information overload our patients, so I try to keep things simple. But if they're willing to engage and want to talk about it, I will. And I encourage them to listen to podcasts and do their own reading and their own searches of appropriate, good resources to learn about all of this. I try to empower them to be partners in their healthcare and really to be self-motivated and managers of their healthcare. I want to be their coach, not someone that they dread to come to see about how poorly they're doing.
Good, and motivation really is key, isn't it? We don't live with these patients and have them hand them their pill every day and say, "Here, don't forget your statin."
Well, you're correct about that. And Steve, I just want to give you a compliment. I've worked with you now for a long time, several decades, and you trained me, and I've watched you practice at Mayo for several decades. And I don't think anyone does a better job than you than encouraging young physicians, patients, and we all need to sort of replicate your positive, we can do this attitude.
You're always very kind, Dr. Wright. Thank you. Now, what about motivating your patients with specific disease states? I mean, we know that, as you mentioned, the medications and more so really the lifestyle can reduce not just cardiovascular events, also cancers, also Alzheimer's. Do you ever try to tailor your discussion with the patient to a disease that they may be more concerned about?
I do, especially if I see those who are either obese or have type 2 diabetes or hypertension. And I try to tailor it to the unique needs they have. If it's a hypertensive patient, we talk a bit more about salt. If they have heart failure, as a clinical diagnosis, we talk about sodium and exercise as well. If they have sleep apnea, weight loss is in calorie restriction. If they have another chronic medical condition, inflammatory condition, or even a cancerous condition, we talk about the benefits of the healthy diets that you've been talking about. So I think we have to try to offer our patients hope and offer them help. And the worst thing we can do is take hope away because, we like to think we're quite learned and educated as physicians, but patients always surprise us with how well they do, and I don't want to take hope away.
Yes. And the other thing to remind our patients, because we all fall into this trap, I think, is that we think that the way we save lives in cardiology primarily is treating the disease once it occurs, treating the heart attack, the STEMI, the stent. But actually, we save the majority of our lives, don't we, by preventing the disease from ever occurring.
Absolutely, and every cardiologist really should strive to try to prevent those events that we now often treat. That it would be great to sort of reduce the need for our specialty area, if we could, by a third in the next decade or two by really working on prevention. And I think we need, as a society, to better garner forces together, really, to say what can we do to encourage cardiovascular health and longevity, not just not on the individual basis, but on a larger basis too.
Good, certainly. Now, one final thing is, what about you've been involved in some of these new therapies, the RNA therapies. Do we have much data on, we have some data on statins, as I mentioned earlier, but data on the RNA therapies, how much lifestyle plays a role in there? What's the effect of it? It doesn't change the lipids probably, but does it overwhelm the benefit?
It likely does. We don't have the data yet because these therapies are fairly new. They've been approved 2 to 3 years, and one needs 5 to 10 years of real-world experience before you can start finding those things out.
Yeah, it's very true. We have to stay vigilant and keep observing. So thank you, Dr. Wright. This has been a very informative discussion. The idea that lifestyle is still extremely important. We need to remind our patients of that. As Dr. Wright pointed out, they sometimes think taking the pill or the injection is all they need to do, but it really is how you eat, how you exercise, how healthy your sleep is, and how well you mitigate your stress. So, Dr. Wright, we really appreciate you joining us here, and we'll see you again.